There's just no way we'll ever be able to fully connect to ourselves as long as we're numbing out or getting our needs met with the food. We actually have to feel everything, the pain and the joy. We can't do that when we're numbing out with addiction.
Food Addiction is a podcast that explores the disease of food addiction and presents the solution. We interview professionals and counselors who specialize in the disease of food addiction as a substance use disorder. And we interview individuals who have successfully recovered from food addiction and discuss how they did it. Esther Helga Guðmundsdóttir was motivated to change careers after she recovered from food addiction by opening a food addiction treatment center and the INFACT School, the International School for Food Addiction Counseling and Treatment. It is the world's first and only evidence-based training for counselors, nutritionists, therapists, and medical professionals that provides training in the effective treatment of food addiction as a substance use disorder. Students receive an internationally recognized credential as a certified food addiction professional, CFAP. Check out the website at infactschool.com, INFACT school.com, for more information on obtaining the certification in proven food addiction recovery programs. Listen to these episodes as we discuss the problem and the solution to food addiction. I'm Susan Branscombe, a recovered food addict and the host of the INFACT School podcast. Today on the podcast, we welcome two guests who have served before. They are Amanda Leith and Esther Helga Guðmundsdóttir. Welcome. Thank you for taking the time today.
Thank you for having me.
Hi, Susan. Glad to be here.
Mm-hmm.
Yeah, I'm getting goosebumps already. Today, we're going to explore food addiction as a substance use disorder and how effective treatment is, and talk about treatment programs. We're going to dive into some important things like recognizing food addiction, how food substances affect the brain, and then willingness, withdrawal, treatment, recovery, and support. So that's what we're going to focus on. I'm going to introduce both of you now, and I'll start with Amanda, and then we'll get into some great questions. Amanda Leith is the owner and operations director of Shift, Recovery by Acorn, which she launched in 2019 to carry forward and expand the 30-year legacy of Acorn, Food Addiction Dependency Recovery Services. A certified addiction counselor and recovering food addict, Amanda has been part of the Acorn team since 2015. Before recovery, Amanda was morbidly obese, depressed, and had resigned herself to a lifetime of misery. She didn't know yet that she was a food addict, physically dependent on certain foods, and she was stuck in a cycle of diets, shame, weight gain. That changed when she attended the Acorn intensive session. She discovered that she had a disease and learned about the solution. Through abstinence and a 12-step recovery program, Amanda's life has transformed. Within months, she was off all diabetes medications, free from compulsive overeating, and finally hopeful. Today, Amanda is physically healthy, joyful, and passionate about helping others find the same freedom. She is a certified food addiction counselor, CNAPS-trained advanced relapse prevention specialist with a background in drug and alcohol counseling and group facilitation. Known for her insight and direct, compassionate approach, Amanda helps clients identify the core issues driving their addiction and find the path to lasting recovery. And Amanda and Shift have been loyal sponsors. To learn more and get a free consultation, visit foodaddiction.com. Welcome again, Amanda.
Thank you, Susan. Thank you.
Yeah. All right, Esther, and last but not least, this Food Addiction podcast is proudly owned and sponsored by the INFACT School, founded by Esther Helga Guðmundsdóttir, who's joining us today. Esther is an internationally recognized pioneer in food addiction treatment and education. She's based in Iceland, where she founded and directs the MFM Food Addiction Treatment Center, one of the first facilities in the world dedicated solely to food addiction treatment. Since opening its doors, the center has helped over 3,000 individuals begin their journey to recovery. In 2017, Esther founded the INFACT School, the only institution in the world devoted entirely to training professionals in the science and treatment of food addiction. This intensive 7-month virtual program is open to students around the world and leads to the Certified Food Addiction Professional Designation, CFAP, which is recognized across Europe and the United States. The robust curriculum combines academic study with hands-on training. Students learn how to screen for food addiction, conduct assessments, intake interviews, and apply evidence-based counseling techniques focused on abstinence and recovery. The program also addresses the neurological, psychological, and behavioral aspects of addiction. Classes will begin again this year, September 2025, and enrollment is open at INFACTschool.com. Esther's expertise is not just professional, it's deeply personal. Her own struggle with disordered eating began in her teens, driven by a belief that she was overweight. That belief spiraled into decades of dieting, fasting, and binging with no lasting solutions. It wasn't until the age of 48 that she discovered freedom through a 12-step recovery program and abstinence from trigger foods. That pivotal moment marked the start of a profound transformation. Today, she maintains a 130-pound weight loss, not through willpower, but through healing the emotional wounds at the root of her addiction. For Esther and for thousands she's helped, recovery isn't about dieting. It's about rewiring the brain, healing the spirit, and breaking free from the cycle of food addiction and recovery. So that was a mouthful, guys. Welcome again. And I didn't want to leave anything out. Really impressive. You guys have both been through it personally, and I admire you both tremendously for your work. So welcome again. Yeah, let's dive into some questions. I want to hear from both of you. Amanda, I'll start with you. Many of us come to the solution, and it takes a while. We're not done. We're not ready. So tell us a little about your journey and what has led you here.
Yeah, thanks, Susan. Gosh, when you were reading my bio, it kind of gets me just hearing you talk about what my life was like. So I always just have to pause there and be so grateful. So my journey here, yeah, it's been long and winding and certainly not linear. Food from when I was young was important to me. I was a chubby little girl, and I enjoyed food. And then in my teenage years, other things became more important than food, alcohol and drugs and boys. And food wasn't such a big deal to me then. And then when I got into my early 20s, certain things happened in my life, and I put in quotes, I slowed down my drinking and drugging because I certainly didn't get sober, although at the time I would have said I was, and my food went off the charts. Actually, what I should say, I wouldn't have known my food went off the chart. My weight went off the charts. It got larger and larger and larger and larger. And no matter what I did, nothing would fix my problem, which at the time was a weight problem. So I thought, all the different diets. I had weight loss surgery. I mean, I really worked hard. And all that kept happening was I got larger and larger and larger and more depressed. And food was becoming more and more of a major player in my life. And I had a lot of treatment for years with an eating disorder therapist. And I did a lot of mindful eating and intuitive eating. And nothing worked, which led me to just keep feeling more and more like a failure. I couldn't get this. And I'd been part of different 12-step fellowships for years and knew about addiction. And for me, what happened was when I finally, so I had my weight loss surgery. I think I lost 20 pounds in total on that. And then again, as I say, I got larger and larger, and I now had diabetes and high blood pressure and high cholesterol. And, I'd go to the doctors and they'd be like, Amanda, like you can't. And I was like, I know, but I couldn't stop. And I just felt really more and more like a loser, and no one really had help for me. And I was a drug and alcohol counselor at this time. And I wanted to look into food addiction as a professional. And so I went to what was called Acorn at the time. And for the first time in my life, I got my proper diagnosis. I didn't know I'd had the wrong diagnosis. I had no idea. What I'd been treated for my whole life was either obesity or emotional eating. And I had both of those, but they were a symptom to my number one disease, which was food addiction. And so as soon as I got that treatment, my life drastically changed. And that was 10 and a half years ago. So there's lots more to my story, but that's kind of the gist of it and where I am. And I'll just say, I've absolutely lost over 130 pounds and kept it off. And I don't have, diabetes and high blood pressure and high cholesterol. Those things are all true. And, my self-worth, my self-esteem, my depression, all of those, my depression has gone down. The others have gone up. Of course, I'm still a work in progress, but both physically and mentally, my life nothing is the same today as it was 10 and a half years ago. So that's a very Coles Notes version of my story.
Yeah, I saw the before pictures on your website, and I know that you've, and what we do is we go through our lives looking for solutions to it, and you've done it, diets, surgery, and all that. And it's like, oh, it's food addiction, So, yeah, Esther, we're going to talk about food addiction and the brain disease and so forth. But Esther, maybe you could tell us a bit about your journey.
Thank you, Amanda, for your story. I get so inspired always when I hear it. I heard it a few times, and I love the way you really go into it and where you came from. And in so many ways, I have a different story, but the same. And so I didn't really have problems. Well, I shouldn't say it, other addictions, but it was always the food. It was always the food and the eating. And of course, when I realized this was addiction, I realized that I had an addictive personality which produces ways to change how I feel, not only with food, but with different behaviors as well. And I didn't have anybody telling me that this was a disease of food addiction. And though I had tried multiple 12-step programs as well, I had not seen any recovery for this until I went to a meeting, a specific 12-step meeting on February the 6th of 2003. It's a date that I remember. And oh my God, I was so frustrated when I came into the room. All of a sudden, I was in a room with people that were happy, joyous, and free. And some were somewhat overweight, but most weren't. And my mind went to, oh my God, one more society of skinny people telling me what to do. And I almost left the place, but fortunately I didn't. And I got abstinent 2 days later. It's more than 22 years now, one day at a time. And I tell you, at that point, I would have never believed that I'd be able to put together a day or two. I came from that place. I was totally gone into the addiction of food. I could not in any way control my food. And it was, the bad thing was, which I didn't even realize, which is something like you, Amanda, was saying, was that I didn't have the concept of what was happening to me. I was just not living a happy life. And I wanted to shoot myself. If I could find a gun, I was thinking, is that the best way to die? There was nothing, no hope. And so we may
Until there is.
There is, yes.
Until there is hope, yeah.
And I think maybe we will talk more about that, is that this is basically the reason I went into, changed my career into this. I didn't want other people to have to suffer in so long, unnecessarily, because this is a disease that is hard enough. Yeah. But we should have support and help.
Yeah, there's a book out there called Wounded Healer. And and that's what I think of as when I think of you two is we because it was a long journey of trying things, then realizing it was food addiction and it was a brain disease, and then it's like let's get to work. That now you're helping others, So let's talk about food addiction. What it is. What are the misconceptions about food addiction? Some people might say, how can you be addicted to food? You need food. How can you be addicted to it? What are the misconceptions? And then let's talk about substance use disorder. So anybody that would like to start?
Yeah, gosh, Susan, when you say the misconceptions about food addiction. So, we very briefly, I'll just say, I think there's definitely different. Food is a tricky thing. It's complicated. It's more complicated than drugs and alcohol when it comes to addiction. And there's definitely, food as a problem and can just be a weight issue. People just have the disease of obesity. They are not physically addicted. They need probably exercise and a good food plan and willpower, and off they go. And there really is people that are like that. And there's many, the pay and weigh programs out there that are fantastic for treating that, right? And then there's the category, the eating disorder, the emotional eaters. And really what these people, they're eating over their emotions, eating over their trauma. So they need support, therapies, counselors, tools to be in this world in their emotions. And then there's the addiction category, which is obviously what we're talking about today. And, there's a plethora of treatment in this world for the obesity and the eating disorder categories. And once we're into an addiction, there's actually a physical component. Sure, obesity might be there, and we're eating over our emotions. But what happens eventually is that once you're addicted to something, the brain actually needs that substance to function normally, to feel okay. And we lose control. Like we can't stop. Once we're in the physical part of our disease, we cannot stop because we crave it. We have physical cravings. We need more. And there's withdrawal from it. And that's addiction. And certain foods and food behaviors are absolutely addictive. And I know we're going to talk a little bit more about that. But so yes, we have to eat. Absolutely, we have to eat. And though we don't have to eat our addictive substances, and we don't have to eat in our addictive behaviors. Just like alcohol and drugs, we can have a black and white program around those things. But yes, we have to eat. And it is harder.
Yeah. We're going to talk about abstinence later. But Esther, what would you say about food addiction? Maybe you can address substance use disorder and misconceptions.
Well, we obviously come from the same base, me and Amanda, basing our addiction treatment on those three concepts of different characters, which is people that can eventually control when they get sufficient support, the emotional eaters that would be in the eating disorder category, and then the substance use disorder. And I think so. Most of treating, the people with obesity, with the diets, and then they have the people with eating disorders, treating them with trauma work and such, which is very essentially important, of course. But the addiction part is not that widely spread. What do we do with the addiction? What is addiction really? And it is, as Amanda, you said so brightly, it's a brain disease. The dopamine receptors, they get knocked out. They stop being able to produce regular well-being dopamine for us. So we eventually get frustrated and depressed because we don't have the well-being. So we're running after the first bite that will give us the comfort of the first bite, which is the high. And and then we get for at least many of us, and probably more people than we expect, we get addicted to those foods. And we know that today, and it's not just because me and Amanda know, it is real concrete science that those foods are addictive. And we know that the food producers have worked diligently for years, decades, to make those foods more addictive to us. And they're still working on it, and so that we can't stop. That's take on this for now.
We're going to talk about food addiction as a substance use disorder relative to the conference, relative to the organizations, but the importance of that is alcohol and drugs is in, and I'll talk about this later, the DSM, so that insurance pays for it. You know, you're addicted to alcohol and drugs physically, not behaviorally, physically. And we're working hard, all of us, to get this into, we'll talk more about it later, but the substance use disorder, that's an important terminology in this, not just say, hey, you're addicted to food. It's ultra processed foods. We'll talk about that. And it is a substance use disorder. Either of you want to talk about that?
So this is putting a lot of stuff out there. So I'm not sure where to start with that, really.
Kind of how my mind goes. So talk about the nomenclature of food addiction as a substance use disorder. And we're going to talk about this later, like I say. But for now, recognizing that we can't stop from starting and we can't stop once we start. That is addiction. Withdrawal is part of it. All of those things that we see in the requirements and the attributes of this, we see and people are assessed. So I'd like to talk next, I think, about abstinence, and I'd like to talk about assessing clients and wherever you think we should start, whether talking about what does abstinence look like. It's not the same for everyone.
Yeah.
Some people might have chips. Some people might have sugar, pizza, all kinds of foods, trigger foods. And it's not the same for everyone. So what does abstinence look like? And then how do you assess that when you take people in?
Well, I would like to start, Amanda. I'll try not to take too long. And when you learn to deal with addiction, there are best practices for that. We have. That's what INFACT teaches. It's best practices manual for how to deal with addiction from A to Z. And one of the first things that you do is screen and assess, and you make an intake for the client, so that you have a way of individualizing the treatment for the person, for sure. And so just to say that, and of course there may be. And it's a simple thing to do, actually, but it is something that, and there are different ways of doing this, of course, but we have the design to how to do that. It is very important that we know where to go from when we get the client in. I just want to say about food plans.
Yes.
It's such a controversial thing. And one thing that me and Amanda, we do agree on is that we just need a food plan. And we cannot have the trigger foods for us in it. That's it. And you can't just change it around because you feel like changing it around. You need to surrender to a food plan until your brain recovers, at least before having changes made to them, if that is at all possible. Of course, we have all kinds of things like health issues and different kinds happening to a person that need to be addressed. But I want to give this one on to you, Amanda.
Yeah, thanks, Esther. I'll just say about, assessment and assessment of clients. I think, just like with drugs and alcohol, there's not like a blood test we can take. Oh, you're an addict, but there's definitely the signs, and we've talked about some of them. There is, do you have cravings? When you stop, do you have withdrawal? Do you have negative consequences that are coming into your life? And despite your negative consequences, you keep using. Over time, do you need more and more and more? So there's these kind of questions that we can ask. There's also something we use a lot of called the Yale Food Addiction Scale, which comes out with a number of where you're sitting in the with addiction. And saying that, I just want to say is I really believe there are different levels, different stages of addiction: early stage, middle stage, late stage. And I believe based on that, you need different treatment, and because of that, very possibly different food plans. So I think the food plan thing, and this is something that, I might differ on other practitioners on, is that I actually think that the details of the food plan aren't as important as, like what Esther said, that there is a specific food plan, except a couple of things. I think what we've seen across the board, and I don't know that there's a provider that would disagree with these, that is treating the disease model, is that sugar in all its forms, all its names, is highly addictive. And I don't know any food addict, early stage to late stage, that can have that.
Sugar.
Sugar in all its hundreds of names. Sugar. Flour is very, very common for most people. Some people could have things like a nut flour, but most people can't have flour. It's highly processed, so most people can't have flour. So a sugar-free, flour-free abstinence plan are two of the most common ingredients, foods that are off any list of people with long-term recovery. The other one is a weighed and measured food plan. And this is for volume addiction, which, I'll probably talk about more when we get into the ultra-processed food label of addiction. But volume addiction, and what we see is this is for people in mid to late stage food addiction, that they will actually overeat any food. So it's weighed and measured. So I think the important thing is that you have a food plan that you're free in your mind. That's what we're going for. Absolutely, we want to have weight loss. But more than that, many people will come to us and they've had weight loss, but they've been, they're on the edge. They're thinking about food. They're dreaming about food, which was how I spent my life. That's not what we're going for. We're going for freedom. So if we're obsessing and thinking about a food, even if it's apparently an abstinent food, that's not freedom. That's not food freedom. So I think the basics of food plans are sugar-free, flour-free, and weighed and measured. And then there's other nuances in there. Some people can't have grains. Some people can. Some people don't have fruit. Some people do. There's a lot of different food plans that work that have those main pieces in it that are completely free of your addictive behaviors and your addictive foods.
Right. Yeah. And once you get on an abstinent food plan, the chatter is removed. A lot of your life around, focusing on food and your weight goes away. But we know that, and Esther and I talk about this, we say here that abstinence without a program of recovery is just another diet. And this is not a diet. This is I'm going to eat what my body needs to function, right? I'm quoting from a great article that was written about you, Esther, a magazine article, and I can put that in our notes. You say, absolute abstinence from trigger foods, extreme support with counselors or peer support people that understand recovery methods for food addiction, and a plan of action that addresses personality changes. It's all there. We start with abstinence, right? But it's not a diet. It's not like, okay, now I'm going to lose weight and everything's going to be better. Yeah. So anything else we want to talk about with abstinence? We know what it's like, the three of us, right?
Well, I so agree with you, Amanda, on the freedom. And I think that's what I was lucky enough to experience in my early recovery, just in the first few days, even if I was in withdrawal and for days and all of that. It wasn't easy. I did get the freedom. And it has been there ever since. So, but I've needed to step into the whole thing, which is the recovery that comes after abstinence.
Right. Yeah, the solution. And there are 12-step recovery programs listed on your website, Esther, INFACTschool.com. So let's talk about something you touched on, Amanda, emotional eating versus food addiction. They're not mutually exclusive. Many food addicts eat emotionally, and they may say, hey, I'm eating because I'm sad, I'm stressed, I'm scared. But they still have this brain disease, the brain response to addiction. Emotional eaters, once they deal with their emotions, they can be, the weight's lost and they're fine, but not food addicts. Talk about that.
Thanks, Susan. I just want to, actually, this is a good segue into both of these, and what Esther was just talking about with abstinence is that we see a lot of people coming to us that over the years have had either the physical treatment or the emotional treatment, but not both. And so there's so many programs out there, beautiful programs that actually have abstinence-based food plans, but don't have all the emotional, the spiritual work that needs to go along with it. It really is a whole package, and vice versa. So the emotional, it is true that many of us eat to feel better, to be happy, to not be so sad, absolutely. And with addicts as well. The deal is, though, is that what we'll see is a lot of people who may have been in therapy for years or are have an amazing faith, they've still got this problem with food. So you can see, it doesn't take long to talk to someone and know what's actually going on with them by what they've tried. And so often for me, when I'm talking to people, when we're doing consultations, they've had years of either doing the food or doing the emotional, but never at the same time. And so as an emotional eater, absolutely part of the recovery program is we really need to learn, we're being spiritually healed. And when I say spiritual, I mean our true selves, our highest selves, our soul is needing to be healed. But we can't heal that while we're shoving addictive substances in our face. And there's just no way we'll ever be able to fully connect to ourselves as long as we're numbing out or getting our needs met with the food. We actually have to feel everything, the pain and the joy. We can't do that when we're numbing out with addiction. And so once we put the food down, holy smokes, there's going to be emotions going on. And so absolutely we need to deal with the emotions then right away. And so this is not, when you have addiction, it's not about putting the food down, it's not about learning the tools to be in the world emotionally and then learning to eat everything in moderation. That won't work for us. It's about doing both of those. And in my opinion, they need to be done together, almost from the beginning. Or if you put the food down and you're not dealing with your emotions, it's going to be too much. You're going to need the food again. And if you work on your emotions and haven't put the food down, you're never going to get deep enough to have the personality change. And the personality change, what we're really talking about is how we react to the world. How we react to the world. You're never going to be able, as long as you're only doing the emotional work and you're using the addictive substances, you're never going to be able to do that if addiction is present.
I'd like to talk about Phil Wardell and the influence he had on your work. And for listeners that may not know Phil Wardell, he founded Acorn, the predecessor food addiction treatment, with his partner at the time, Mary Fushi. And that was the predecessor to the Food Addiction Treatment Center Shift that Amanda now owns and operates. He founded the Food Addiction Institute, which Esther Helga led for years, and I'm still on that board. He counseled more than 50 years and helped 5,000 food addicts, was a prolific writer. He's got many books. He died in September of 2023 after a short illness. And Phil wrote and spoke on some important concepts around food addiction that he felt passionate about. I know that you two do too. powerlessness, denial, willingness, abstinence, and embracing support and recovery. So talk about Phil and what his concepts live on. What is the legacy there in your work?
Oh my gosh, talk about Phil Riddell. I could talk about Phil all day long. Thanks, Susan. So Phil, actually my first encounter with Phil, I'll just say this briefly, was I phoned to talk to Acorn about their professional program for counselors who wanted to work with food addicts. And Phil got on the phone, and within, I don't know if it was 2 minutes, he's like, I don't think you should come for learning the professional program. I think you need treatment. And I remember just being horrified by him, although he was lovely and kind and sweet. Anyways, I think within 5 days, I was on a plane and went to the treatment. And I'll tell you that Phil, in my years, Phil has been, my counselor, my friend, my employer, my employee, and just such a dear, dear mentor to me. And so, oh my gosh, let me just see what I think Phil, I actually don't know of another human being in this world that dedicated their life to treating food addiction as much as Phil has, as much as Phil did. And so they started Acorn. He worked at Glen Bay Psychiatric Hospital. They had a food addiction wing, and then that closed down. And him and Mary Fushi and another woman opened up Acorn. And that's where I got my treatment. And then they sold it, or I purchased it from them 6 years ago. And, Phil's, the kind of, the nuts and bolts of what Phil and Mary were so passionate about are absolutely still the nuts and bolts of the program we have today. And it really is that the idea about surrender, about willingness, acceptance. And Phil was very black and white about what recovery looked like. And he was so loving and kind and generous, and his own personal life was so dedicated to his own recovery, and he was so humble. And I don't even have words to say like the truth about how that's where the majority of all of my training came from Phil. And I'm just, I can't even believe that's such a miracle. And I'm so blessed that is. And our whole, as I say, the intensive treatment program that Shift still has comes from what Phil and Mary created over 30 years ago.
Yeah. Esther, you want to talk about Phil a little bit?
Oh boy. Well, I ditto everything that you've been saying, Amanda, of course. And my first encounter with Phil was when I was looking for people doing treatment or teaching about treatment for food addiction in the world. That was like in 2005 or 6. And I called Acorn and I got him on the phone. And the two of them, Phil and Mary, were driving around Chicago, and we had like a half an hour talk. And it was just amazing to me to just get him on the phone. I had read some of his stuff, and I was so excited about the Acorn experimental program for food addiction treatment. And by that time, I had been abstinent for 3 years. I had done addiction counseling diploma and was trying to find a mentor, basically, for this. And boy, was he ever a mentor. And I can say the same as you, Amanda. It was just, his character was just so surrendered. And he was just so spiritual. I have met many people in that way, and Mary as well. For me, both of them became real mentors to me. And I was, of course, I did the work with them, and then I had them come to Iceland and teach and do work with us here in Iceland. And as we went further, we became colleagues as much as you could a colleague to your mentor, you know. And so he was actually supposed to do a lecture on the day he died for INFACT. And Mary, he was just at the hospital. He wasn't feeling so good. And Mary did hers. And then he died in the evening. And it was sad, but I think he was also, you know, he had given everything, every inch of himself to this cause.
Yeah, he did. He was a prolific writer. He told me one time that he says, I have to write.
Yes.
I just have to write, you know. And I was at the intensive, which was, I think, your first intensive as an owner, and Phil was your employee at that time, Amanda, in 2019. And if you asked Phil what time it was, he would tell you how to make a clock, you know. So the boy could talk. He could talk. But, you know, there was so much there, you know, just a lot there. Always when he talked, it's like, wow, that's, you know. And the thing that I remember the most, and I'd like you to talk about what goes on at an intensive, Amanda, for the listeners. But the thing that he drove home pretty heavily, and he wanted us to write about it, and that is powerlessness. Mm-hmm. When I start eating fudge, why can't I just stop, like I said, at one piece of fudge? Why do I eat the whole box, or why do I eat 4? What is it about that powerlessness? And then what do we do after that?
Yeah. Oh boy. I just want to say, I didn't say this about Phil, and I just want to say this. There's not one thing in my life today that would be the way it is if it wasn't for Phil. I just really need to say that. Phil saved my life, launched my life, really. Yeah, powerlessness. Gosh, I remember hearing about this at my intensive, you know, that's where I got my treatment. And I was like, what is this powerlessness business? And it is such a hard concept. Well, you can't explain it, and it's not just something you get up in here, but Phil really does. That's what the whole intensive is about. It's kind of like if you're coming from the 12-step world, that's what the first step is. And powerlessness, like, what does that mean? What do you mean I'm powerless? Like, I'm picking up this fudge, I'm putting it in my mouth. What do you mean I'm powerless? And so it's exactly what we were just talking about with addiction. It's like, and Phil used to say this so beautifully. It's like, you know, I'm walking along my day, I know I'm going to be abstinent, and then all of a sudden I'm putting fudge in my mouth. There's no rhyme or reason. I have all these reasons why it's a terrible idea. You know, I might just have a thought, oh, it's Friday, I'm going to celebrate, I'm going to have a piece of fudge. When you can see for years of, what do you mean? You can't just have one piece of fudge. You were morbidly obese. You have diabetes. But in that one moment, all thoughts, all future thoughts, all past thoughts are not there. All you can see is, oh, I'm just going to have this fudge. And it sounds in your brain like such a brilliant, simple idea. That's powerlessness. The powerlessness is that the only thought that's coming through is, that fudge is a good idea. And it's Friday, so I'm going to celebrate. Nothing else in your life is there anymore. And that's the powerlessness piece. And I think a lot of people are so like, I'm powerless. That sounds so hopeless. And the deal is this, it's actually not true. Being powerless and being hopeless are very, very separate. We are not hopeless. However, this is the kicker, is that it seems to be that in addiction treatment for many of us, unless we believe and have the evidence that we're powerless, we won't do what we need to do to be in recovery. Meaning that I can't make, in this situation, we're talking about food, making my own food decision doesn't really work very well for me, because at some point my brain is going to kick into that, it's Friday, I need to celebrate, I want my fudge. So that's the powerless point. So what we need to do is all the support that we're talking about in the program after we get abstinent is around the fact that we're powerless. We're like broken when it comes to our addictive substance. And that's the powerless point.
Mm-hmm. Yeah. And we talk about 12-step recovery. That is not the only way to recover there. And you know, in the literature, we know that you don't have to believe in God. Some people say, well, it's a God, it's a spiritual program, I don't believe in God. You don't have to. There are other programs out there like Bright Line Eating, Susan Pierce Thompson, very good program. It is not a 12-step recovery program, you know, but it does treat, you know, talks about abstinence and all the things that go on that you need to do to recover. So just to put that out there, what would you say to when you see a late stage food addict? And I know that you each have people come to you, and some people are more willing than others. Sometimes it's hard to gauge willingness. They've been through gastric bypass. They've done all the diets. They just say, I don't know what else to do. And you assess them as a food addict through the Yale Food Scale. And then how do you see willingness? What would you say to a client that you would regard as a late stage food addict? What goes on there? And talk about the willingness to do something that other people do because you want to be like them.
Well, I'll say a little about that. I have a late stage food addicts in treatment right now, always. And one of them now has been going to this powerless moment. It's Friday, I should have a fudge, the kind of thing. And she's been breaking her abstinence every month for 6 months and then just kicking back in. And she doesn't understand. And what happens, she has a lot of willingness. She has a lot of willingness. She is doing a lot of work on herself. She does 12 steps. She's doing therapy. She is working a pretty good program, I would say, most of the time. Then she had a session with me and finally came clean with using nicotine, starting to use nicotine and starting to use sweeteners as well in excess. And so what I can say with this, there's lots to say about this and different things, but in essence, it is becoming aware of your reactions and where your reactions come from, which is the molding of your life. And then understanding that if you just do things the same way again and again, you will have the same, outcome. And treatment really is getting that you do need to do something different. And that's where people usually need a lot of help and support as they start recognizing, oh, okay, go to this place again and again and again. I feel I should have this. So what do I need to do before that happens is one stage. And then as this is happening, because if it is happening, it's too late, they're going to be eating at that point. Mm-hmm. And then to deal with the consequences and get on the right path and do better next time. That's mm-hmm. also one thing that is important to do. Mm-hmm. So it's the awareness of your reactions and your willingness and abilities to do things differently as you go forward. Yeah. Comes up for me.
Yeah, good. Amanda?
Yeah, an important piece here, I think, for me is I often think about my story. And when we talk about willingness, like when I got on that plane and was heading to treatment, I wasn't willing. Clearly I was willing enough to get on the plane. But I remember when I got there and I got this food plan, and I just remember thinking, okay, sure, I'll eat this food plan while I'm here. There's no way when I go out there, I'm going to be able to eat this food plan. Food is my best friend. It's my everything. And to me, it felt like it was the only thing I looked forward to in the world. And so it wasn't only that I had no belief that I could do it. It was like, I don't want to do it. I don't want to give up. This is all I know. And then I'd think about, what about my birthday? What about my sister was getting married? And, no, I wasn't willing. So I just want to be clear that I don't have people that show up in treatment all willing. Here I am. What do I need to do? That's just not what it's about, in my experience. But they were willing to get on the plane. And then they come, and that very first night, they're willing to have that one evening meal, abstinent. And then the next morning, and so I remember that. And I remember saying, I'll just say this, my very last day of treatment, I was crying, and I said what I just said. I said, okay, this is great, but I know as soon as I get out there, there's no way I will be able to be abstinent. And I have been abstinent one meal at a time for 10 and a half years. And so I guess, I mean, there's so much more to say about this, but I think it's really important for us to say, I'm not willing to do right at this moment things that I have to do tomorrow because I'm not there. But if I really, and some people get so annoyed by this term, and I get it, but like, it's like, can I be willing to do what I need to do for the next half an hour? And yes, I can be. And I'll tell you, in the early days of my recovery, I remember someone asking me that, and I was like, no, I can't. I can't. They're like, how about 5 minutes? And I was like, yeah, I can do it for 5 minutes. And so just to be clear, it's just the willingness to take whatever I need to do next. And we get moment after moment after moment, and moment after moment after moment of being willing is what we put together in our life.
Yeah.
And so I just think it's important to talk about that. It's not this big, yes, I'm so excited and I can't wait for this, to put down my foods.
Right. And Shift After the Intensive does a great job of supporting people in recovery just with the aftercare kind of thing. I want to mention that. And then 12-step groups, we have meetings, we have fellowship, we have ongoing support there. But I think we're all doing this one day at a time. So I've got a couple more questions for you. And I'm going to set this up for the listeners, and you guys will know how, where I want to go here. Food addiction as a substance use disorder, like alcohol and drugs, is not recognized by two important governing organizations. One is the World Health Organization, which has what's called the ICD, International Classification of Diseases. And in the US, American Psychiatric Association, which has the DSM, Diagnostic Statistical Manual. And these organizations have, for example, APA and the DSM has alcohol in there. Food behaviors, behavioral psychological addictions, and there's overlap here, like binge eating disorder, like anorexia, like bulimia, those are in there as psychological disorders. So there is a movement, a group of professionals, many PhDs who have studied this brain disease, who have worked with months and have developed a consensus. And each of you have signed that consensus that ultra-processed foods are addictive and they are a substance use disorder, and they need to have a place in those manuals, the classification. Many of the people here have studied the brain, similar response. There was a consensus conference. A lot of work went into this before the conference to come up with a consensus, May of 2024 in London. International Food Addiction Consensus Conference. There's another one set up to happen September 4th and 5th of this year, 2025. The two of you have the distinction, and it's a small group of people. You can study it, you can talk about the problem, but you've actually treated people with food addiction. So talk about this conference, talk about the movement. There's a lot there that I just talked about to set it up, but I want you guys to talk about your feelings about this and what you believe.
Sure. Yeah. So, and I'll just say, these people really have worked not just for months, but for years getting to this point. And many people before them have worked for years and years getting to the point of getting this in the DSM. And, there's many good reasons why we want it in the DSM. Once something's in the DSM, it's really about the medical community then will accept it, will diagnose it, will treat it and possibly refer it. And a huge benefit to the population is that, insurance will pay for it. And so it would be a huge benefit really for the medical world to accept food addiction as a disease. And they're getting more and more that way. And literally, and Phil Wardell, talking about Phil, was part of this movement. I mean, for years, this has been, an ongoing thing. So to all the people that are doing that are, I'm so grateful. And I'm certainly not a doctor and I'm not a scientist. So what I will say is that what it's ultra processed food addiction is the title of it. And I was not supportive of that in the beginning. And I am now, and I'll tell you why. So I was not supportive of it because I experienced, both personally and professionally, all the time, that it was a lot more than just ultra processed foods that people were addicted to. And then as the group started talking about this and I started hearing more about it, what came to me was that for the purpose of getting it in the DSM and the reasons we need it in there, it really made sense that it was called ultra processed food addiction, because the DSM has a lot of ramifications outside of treatment. And my view was treatment. That's what I'm looking at, how people are treated. And I was worried that with the title ultra processed food addiction, we would miss what treatment was needed. So, however, going in the DSM, the ramifications of it, there's ramifications, worldwide. There's ramifications on our school systems, on our prison systems. And there's no way that if we called it food, it was way too big of a category. It was never going to be accepted. So I'll take ultra processed food addiction as a diagnosis. And then my view of it being treated, I can take in all the other parts of it, which is volume addiction and other things. So I can look at it through treatment, but if there's a base of it being called ultra processed food addiction in the DSM, that just feels like a win-win for everyone to me.
Mm-hmm.
Yeah, absolutely. I followed up on this process, and the Food Addiction Institute, among other things that we did when I was the chair, we launched the first application to the World Health Organization on the subject. And we got denied. So now that it's in a process of being resent. And while that is what's happening, we've gotten Asli Gerhardt et al. Sending in the application to the APA, which is the American Psychiatric Association for DSM. And I just want to say that with that work that has been put into it, and with all the science and the understanding at this point, I cannot see how they can deny it. They may, but I can't see that they can. So I want to be, and I am optimistic that we will get it through. At this point, it's going to probably be into the science category. And while they're figuring out what me and Amanda and a few others in the world have been doing for 40 years, how to treat it. And so that's really the cork in the bottle for those professionals. They don't know what to do about it. And just one last thing on this is that when alcoholics got their acceptance in the DSM in between 40 and 50, I can't remember the date, it didn't say that alcoholism hadn't been there before. They decided it was a disease. We are dealing with this as a disease, and we will be doing it after they accept it, whenever that happens, for sure.
Yeah. And there are still alcoholics, despite the fact that it's in there. Absolutely. There will still be food addicts. I mean, it's really a matter of someone saying, I weigh too much. We're going to talk about not being overweight, but I weigh too much. I want to live differently. I'm willing to do what you do, and I'm powerless over it. And then let's get to work. That's really what it's about. And that's the way I think the three of us have lived happy, joyous, and free once we've accepted the disease and the recovery. So, which sets me up for my last question. What would you say to someone, number one, who is, say, 50, 70, 150 pounds overweight and have tried everything, Ozempic, whatever, and nothing works long term? Or someone perhaps that does not suffer from weight issues. We know that weight and obesity can be a symptom of food addiction, but not necessarily. There are people that are obsessed with food, restriction, over-exercising, but they're a normal weight or underweight, but thinks about food all the time. So what would you say to that person about hope and what's available to them?
Well, I just want to say one thing with weight issues. There's different kind of food addiction or sugar addiction. And in what I see is that with people that are more sugar addicts, they don't usually have the big weights. They will start developing that more as time goes, but they may not have weight issues, and they are suffering tremendously because of their disease. They will have all the diseases, and they will have the powerlessness and not being able to stop when they want to.
Right.
And then there are the others, that the real food addicts that I call, and the sugar addicts, they don't like to eat too much food. They just like to get the stuff in there as fast as possible. But the food addicts are more, they eat the volumes. Those would be the ones that would probably need to weigh and measure their foods and stuff like that.
Right.
And when I get a person in, we do assessment, and I see usually, and we take a look at what stage the person's in is, and I tend to not say too much, what's going to be happening as they start it. Yeah. But I do tell them this is treatment for addiction, which is not a health or diet treatment. And one lady the other week asked me, so can I just go to some kind of a health spa? And I said, no, not if you want to recover from addiction. You need to get treatment that addresses the personality changes that happen as a result of you using food, substances, and behaviors to change how you feel. You need to learn to do differently. Right. So I do kind of try to get that in there. It's the breaking of the denial. They usually don't think it is that bad. Maybe it's not that bad. And you just need to get them in there, sell them the treatment some way, so that they just come, and then you start the work.
And we can't recover for them. They have to accept it, that it's their issue to deal with. And it's like, you're there to help them. But if they continue to lie or not remain abstinent, that is, you can't recover for them. They have to want it. Amanda, as we close out, what would you say?
Yeah. I'm glad you mentioned about the, different weights. And I just say, all I'll say about that is weight really is not, we can have people underweight, normal weight, I'm saying in quotes, or overweight, and food addiction is present. So great point to make, Susan. And doesn't matter what your size is, people can be brutally suffering at any size. So this is what I'd say to someone out there who's struggling, is there really is so much hope. And if you have tried so many things that we're talking about, like whether emotional eating or weight loss, and it feels like there's nothing out there, addiction might be a possibility. And all I say to people is just have an open mind that addiction might be a possibility. And then, we don't have to know how to do it all at the same time. We don't it can, and I really want to ride that home. This is just one day at a time. And it can be, I guess this is the last thing I want to say, is I was someone that never believed in my life I could actually be free of desperately wanting food and food being my best friend. And I am living that way every day. And I see people just like me in treatment all the time. So if in your mind you're saying, nah, maybe you can, but not me, or I'm different, or all the stories, I was the same way. And I hear this every day. And I just want to say to people, there really is so much hope. And most people, by the time they get here, they've done a lot. They're exhausted. They're beaten down, and it makes sense why they're hopeless. And just check it out. Just check it out. If addiction is a possibility, and you never know. You never know what can happen in your life.
Yeah,
miracles happen.
Great. Yes, miracles happen, and recovery is possible. And as the podcast says, Esther, food addiction, the problem and the solution, right? There is a solution. So wanting to live a different way is a start. So thank you both for joining me and serving on the podcast. I know, Esther, you appreciate it. It's your podcast, and I just admire you both tremendously. Thank you for your work.
And
thank you, Susan.
Yeah, I just want to say thank you, Susan, for doing this. And thank you, you've been amazing doing all of those podcasts. I would have never thought that would happen in such a great way, but it has because of you. Yeah. And Amanda, I want to thank you as well for being here and with us. Always a big honor.
Well, thank you for trusting me to do this. And I've loved it. I've loved every minute of it. Thank you for listening to the Food Addiction Podcast. We hope you both enjoyed the episode and learned more about how food addiction is recognized and treated. Please rate and write a review on this podcast and share it with others. If you or someone you know is suffering from the disease of food addiction, there is a solution with trained professionals at the INFACT School. You can become a food addiction informed and certified as a food addiction professional, as well as receive your own treatment through the various training, certification, and treatment programs offered at the INFACT School. Go to infactschool.com. That's INFACT school.com to learn more.